Hi, I'm Robin Landwehr, a licensed professional clinical counselor here at Spectra Health in North Dakota. At Spectra, we integrate primary care and behavioral health services so our patients may receive comprehensive, coordinated support all in one place. In this video, we'll review the types of treatment providers available for alcohol use disorder, along with community support resources that can help individuals who may be struggling with addiction. Establishing strong referral relationships with these providers is essential for assuring that patients receive timely and effective care. People who struggle with substance use disorders, including alcohol use disorder, often have social vulnerabilities that put them at substantial risk for poor treatment outcomes. When assessing a patient and identifying the need for a referral to addiction treatment, it's important to recognize the unique challenges that different populations may face. For example, individuals who are in rural areas may face transportation barriers or provider availability issues. Patients experiencing homelessness or food insecurity might not view recovery as their immediate priority. Attending appointments can be extremely difficult under these particular circumstances. Meeting patients where they are, emotionally and especially practically, by offering support and referrals tailored to their current situations can strengthen engagement and improve the likelihood of follow-up. When referring patients to addiction treatment, it's important to understand the various levels of care. Outpatient or office-based care may be appropriate for some. Others may require medically managed withdrawal, formerly known as detox, or inpatient treatment. These decisions are typically based on the initial assessment. That's why it's essential to become familiar with local providers, their services, and what levels of care that they offer. If you or your clinic can offer medications for opioid use disorder or alcohol use disorder, such as buprenorphine, naltrexone, or methadone, we strongly encourage that you do so. These are life-saving treatments and are often a critical first step in a patient's recovery journey. Helpful tools to locate treatment providers include SAMHSA's Provider Locator, Vivitrol Provider Locator. For patients facing financial challenges or lacking insurance, federally qualified health centers, also known as FQHCs, can offer services at a sliding scale. In addition to addiction and mental health treatment, connecting patients with services that meet basic needs is crucial. These include SNAP benefits, Medicaid or Marketplace enrollment, domestic violence or emergency shelters, housing support, low barrier shelters, food pantries, and transportation assistance like Uber Health. One agency that you may refer to often is your local housing authority for patients who have housing insecurity. One of our programs at Spectra partnered with our local housing authority to co-author a grant enabling case management services for individuals who are unsheltered and struggling with addiction. This opportunity occurred because members of the local housing authority and staff in our clinic served on the same local coalition to address homelessness and frequently work together to help unsheltered people in the community. Low barrier shelters, which do not require sobriety to stay, can be particularly helpful for individuals early in their recovery. These shelters aren't available everywhere, so you'll want to make sure to learn what you have available in your area. Many communities offer peer support services, mutual help groups such as Alcoholics Anonymous or Smart Recovery. Peer support specialists have lived experiences with addiction and or mental health treatment, and they may work at a treatment facility or they may be employed by an independent agency. Using websites like findhelp.org make it easier to locate local resources by simply entering in a zip code. This makes access quicker and easier for both providers and patients, which increases the likelihood of follow-through. There are also mobile apps that support recovery as well. The Smart Recovery app offers tools, meeting locations, and CBT-based strategies to help manage cravings. Apps based on the AA model include the full Big Book and can be a valuable supplemental tool in a patient's recovery toolkit. Some services, like peer support groups, don't require a formal referral, but having someone to help the patient take the first step, like calling the peer support line, can make a significant difference. If a patient isn't ready for a referral, you can still provide them with a printed list of treatment providers and support services to keep on hand when they are ready. This list might include local and national hotlines like 988, which is the Suicide and Crisis Line, or SAMHSA's national helpline, 1-800-662-HELP. Take time within your organization to learn what's available in your community. Consider joining interagency meetings or local coalitions to build relationships with other providers. These partnerships can lead to unique referral opportunities that can benefit patients in meaningful ways. Thank you for your commitment to supporting individuals on their recovery journey.